At Capella University, you can learn at your own pace with our FlexPath learning format. Take 1 or 2 courses at a time and complete as many as you can in a 12-week billing session. With FlexPath, you can even finish the bachelor's degree you started in 22 months for $20,000. A different future is closer than you think with Capella University. Learn more at capella.edu. Fastest 25% of students. Cost varies by pace, transfer credits, and other factors. Fees apply.
Give your kids a summer full of fun and learning. Give them ID Tech. ID Tech camps are all about high-energy fun, meeting new friends, and are taught by elite instructors. Located at 75 prestigious college campuses all across the country, ID Tech features over 50 epic courses like BattleBots, AI and machine learning, coding, game design, and more. There's something for every kid ages 7 to 17 at ID Tech. Sign up at idtech.com and use code IDTech to save $150 on a week of a lifetime.
There are a lot of things to panic about when it comes to our kids. And there are a few things that truly keep you up at night. I know this. These are things you could never talk to another parent about, and that's when parents call their pediatrician. Today, I'm covering one of those topics, and it's a tough one. I'll be talking about normal sexual behaviors in kids, so you may want to listen to this one without small ears around. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kids' health. I mix the science of medicine with the reality of parenting. It's not uncommon for me and every pediatrician to get a call from a distressed parent that they have found their child naked with another child, or their child has told them about an encounter with another child's genitals. It's truly among the most horrifying experiences for a parent. The most recent cases I have had, and I think these are very representative of typical experiences. One was a 9-year-old girl who was at a sleepover with another 9-year-old girl, and the parent found them in bed with their clothes off. And the other, more recent case was a 4-year-old girl who told their mom that she went to the bathroom at preschool with her male 4-year-old friend, and they took their pants off. I know where your mind goes on this because my thoughts go there too. But unlike you, I have an expert I can call. Her name is Shalon Nienow, and she's a pediatrician who specializes in child abuse. She's here to explain what are normal sexual behaviors in children and when we should worry. Here she is.
Normal sexual behaviors are really common and freak parents out a lot. And so the presumption by parents is that this indicates that one of the children has been sexually abused at some point in their life and that now they're perpetrating on the other child. When in fact, body curiosity is such a normal, common developmental thing. And it just opens the opportunity for parents to help reinforce body autonomy, consent, and all of those safety issues. Normal sexual behaviors actually are the most common between ages 3 and 6. And so that's when we'll see them the most frequently. And it really prompts parents to become very upset and ask inappropriate questions. And that's one of the problems that we run into is when parents ask leading or loaded questions, then the child provides an answer to that question, and that answer cannot be interpreted because the leading or loaded questions are causing the child to answer in a way that's not a true disclosure of sexual abuse, if that makes sense.
That makes perfect sense. And that's the other scenario I hear often from parents is the 4-year-old at preschool who went into the bathroom with another 4-year-old at preschool and something happened, touched their genitals, showed each other their genitals. And then the child mentions it and the parents start digging in. So you said parents can, I know they don't do it on purpose, ask leading or loaded questions, but how should a parent respond when their 4-year-old says something like this?
Usually the 4-year-old doesn't come out and say it. It's elicited through questioning. So that's the most frequent scenario that I see. If a child talks about looking at or touching somebody else's genitals, especially a same-aged peer, when we're talking about that normal body exploration, then the best question would be, how did that make you feel? It's an open-ended question. It elicits a narrative from the child, and it helps the parent understand or get a better sense of, this was something that I was engaging in because I wanted to and I was curious, which is the hallmark of developmentally appropriate sexual behavior, is its mutual curiosity. When we become concerned is when one child is forced into engaging the behaviors, because that's not normal. And then we would be worried. So having parents just say, how did that make you feel? And thanks for telling me. It's really important that you tell me about things that happen to your private parts. And this is a great time for us to talk about who's allowed to look at or touch your private parts and under what conditions.
That's such a simple answer and such a simple phrase for parents to use. But I know in the moment, your head starts spinning and you think, oh my God. And you go to all of these scenarios and you imagine things. So parents need to take a breath and just say that simple phrase, how did that make you feel? And thank you for telling me. And then we talked about a big age range here from like 4 to even up to 9, 10, 11. And you said it's an opportunity to talk about consent and body autonomy. So how do you start that conversation? And how does that conversation happen with a 4-year-old versus a 12-year-old?
I tell parents all the time, there's never a age that's too young to start these conversations. I started talking to my personal children about this as soon as they were verbal. So starting at like 18 months of age and giving names to body parts and talking about who's allowed to look at and touch body parts. Like a doctor's allowed to look at your private parts as long as mom is there. And if you need help, moms and dads are allowed to look at or touch your private parts if you need help wiping, or if you have a problem and somebody needs to help you out with that. So helping them to understand appropriate times that people can look at or touch their private parts versus when it's not appropriate. So with the little kids, again, using anatomical names and talking about those private parts so that they know it's okay to verbalize it. I think that's another issue that we as parents often have, is we're afraid to discuss them. So we use code words or cutesy names. And those code words imply to children that they're secret and it's not something we're allowed to talk about. So normalizing that private parts are just another part of the body, like your elbow or your nose or your ear, and you can speak about them, is really one of the most fundamental ways to teach body autonomy. Okay to talk about it. It's a private part. We all have them. We can speak about it. And then consent is a really simple concept. Again, it's never too early to talk about consent. With our littles, one of the best ways is we don't touch other people's body without their permission, and nobody's allowed to touch our body without their permission. We as adults tend to presume that kids have relationships with people that we have relationships with, like grandmas and grandpas. And so we'll instruct children, go give grandma or grandpa a hug, which is kind of undoing that consent. So one of the ways that we can reinforce consent is to say, do you feel comfortable giving grandma or grandpa a hug? If you don't feel comfortable, that's okay. Let's talk about a way that you can show love and caring for somebody else without submitting your body to them. Like we can give high fives or we can give thumbs up, but really simple consent things like who's allowed to hug you, or are you allowed to hug a friend? Not all friends are huggers. So ask your friend if they are okay with you giving them a hug and wait for that specific yes before you give them a hug. So starting that really early is helpful. The older kids, obviously, it's a little bit more broad. And so talking about safe friendships and safe relationships. Teens and tweens are now engaging in dating or boyfriend-girlfriend relationships really young, and talking about what a healthy relationship is and what consent is with kissing, hugging, holding hands. That same type of thing is a really simple concept.
Dr. Nienow is touching on something that is very important to note, and that is that kids need to understand that they have a choice to decide if they want to be touched. And here's where this comes up. All kids know that adults are authority figures. They have to listen to their teachers, coaches, tutors, clergy members, and they have to do what they say. So they aren't going to know it's wrong if an authority figure touches them when your child doesn't want to be touched. But if we teach our children that they get to decide who and when they are touched by, this could potentially prevent what is known as institutional abuse. I covered this back in episode 46 when I talked about the fact that at least 1 in 5 adults reports that they were victims of an adult when they were under the age of 18. Unwanted sexual contact is far more likely to occur with an adult authority in your child's life. And as scary as it can be to have your child in one of these situations, it also is an opportunity for you to teach your child about body autonomy. Dr. Nienow and a colleague share some strategies, and that's next.
This episode is brought to you by LifeLock. Not everyone is careful with your personal information, which might explain why there's a victim of identity theft every 5 seconds in the US. Fortunately, there's LifeLock. LifeLock monitors hundreds of millions of data points a second for threats to your identity. If your identity is stolen, a US-based restoration specialist will fix it, guaranteed, or your money back. Save up to 40% your first year by visiting lifelock.com/podcast. Terms apply.
This Mother's Day, give mom more than a gift. Give her lasting comfort. I'm Tyler, founder at Cozy Earth. Our bamboo sheets and ultra-soft pajamas are crafted with breathable, temperature-regulating fabric to keep her cozy year-round. It's comfort that feels like home, because home feels like mom. With a 100-night sleep trial and a 10-year warranty, you know she'll be in good hands.
Go to CozyEarth.com/Spotify and use code Spotify to save up to 40%. That's CozyEarth.com/Spotify.
How can you talk to your kids about these sensitive subjects? Your pediatrician can definitely help, but we don't always have a lot of time. That's what Rhea Polsule discovered. She's a 4th-year medical student, and she aims to help parents navigate this and how to prevent child abuse. She started by looking at the written information that parents are given at their well child visits. We give written advice at every visit in the form of a document called the After Visit Summary. Here's Rhea to share her work.
When I was a 3rd-year medical student, I was rotating at an outpatient pediatric clinic. And in the after visit summary, something that I noticed is that the only thing about preventing child sexual abuse was don't talk to strangers. And I think with rotating through the child abuse pediatrics rotation and talking with experts in the field, I think 90% of perpetrators are someone that the child knows and trusts. And so that is kind of misleading a lot of caregivers about preventing child sexual abuse. So that's why I came up with this idea of including information in the after visit summary for each kid who comes in for a well child check, with information about what's normal sexual behaviors by that age group, appropriate times to be discussing proper names for body parts and genitals with your kid, whether it's at bath time or in the pediatrician's office, and then also the role of a pediatrician in discussing these topics during the anticipatory guidance portion of the well child check, both giving children the tools to describe their abuse by giving them that proper language, but also empowering body autonomy and body safety in the clinic. And so I think that was a great way to just have that out there in the pediatrician's office where, you're creating this long-term trusting relationship with the pediatrician, the caregivers, and the patients. I think that's a great way to use evidence-based medicine to prevent child sexual abuse.
The most effective thing you can do as a parent to protect your kids from unwanted contact is to talk with them about their body. It also helps you as a parent to know what is normal and what is not. Kids are naturally curious about their bodies. They want to know how things work, what's similar or different between them and other people, and they want to know what feels good or strange. It's our job as parents to guide that curiosity in a healthy, age-appropriate way. The goal isn't to shut it down, but it is to teach boundaries, safety, and respect. So what is normal at the different ages? Let's start with infants and toddlers, so 0 to 3 years old. At this age, kids may touch their genitals during diaper changes or when they're falling asleep. It can be a comfort to them to rub their genitals, and that's normal. This isn't sexual in the adult sense. It's more like, hey, this feels interesting. Just like they'd explore their toes or their belly button, it's really the same thing. As you may have noticed, toddlers have no clue about privacy or why certain parts of the body are covered. So they don't mind taking off their diaper at like the grocery store. They just don't know that some parts should stay covered. So what changes as kids get into the preschool years? Around age 3 to 5, they may start to ask you questions like, why doesn't she have a penis? Or where do babies come from? You can answer with very simple answers. You don't need to go into any detail at this age. Answer something straightforward and concrete like, she doesn't have a penis because she is a girl. That is usually good enough, and that's all they really want to know. Preschool age kids might explore their bodies with same age peers through playing doctor or undressing games, and that is not unusual. It's very typical. And it's not uncommon to show and look at each other's genitals out of curiosity at age 3 to 5. They don't have any intent to be sexual, and many kids may want to see their parents and others in a state of undress because they're curious. And if young kids see things on TV or the internet like kissing, they might mimic this and try to kiss their peers. This behavior can surprise or embarrass us as adults, but it's usually just part of normal development. Your calm response makes all the difference. A great resource at this age are the books Some Parts Are Not for Sharing and My Body, What I Say Goes. I'll put the links for those in the show notes. Dr. Nienow shared some pearls of information with me. Unfortunately, our interview was sabotaged by her neighbor's loud woodchopper. So I'll just tell you what I understood from her brilliant experience. She likes to use the acronym MUST, M-U-S-T, regarding masturbation. She says kids masturbate when they need to urinate, are stressed, or tired. That's M-U-S-T. She says kids also tend to self-stimulate around nap time. She said it can be alarming to parents when kids rub themselves on other things like furniture. Parents might call it humping. She's heard that before, but they're just rubbing. It's not really a big deal. You need to just ask them to do it in private. She says the other unique thing that kids might do is they could start self-stimulating when they don't want to leave a place. Yeah, that's awkward, but it's normal. One of the strategies she says works well is if your kid is self-stimulating, ask them to go to the bathroom. They often just need to pee to get them to stop doing it. Let's talk about school-age kids. So age 6 to 9, things get a little more complicated in this crowd. They start to develop a stronger sense of modesty and body boundaries. They might start testing out adults' responses to things by using potty language or laughing at jokes about private parts. And actually, sometimes it's kind of funny. Sometimes they might explore with other children, just like the girls at the sleepover did, but they are different because they might feel embarrassed afterward. This is a great age to reinforce body safety rules. Use the correct names for body parts, understand consent, and learn about private parts by talking about things that are private. One very surprising thing I learned from Dr. Nienow is that putting objects in their genitals is also not necessarily abnormal. Kids love to put things in their ears, noses, and apparently this is no different, though it was kind of alarming to me. As kids near the teen years, so age 10 to 12, that's when they really start to become more private and maybe curious about sex. They might start looking for information online, or they might start talking to you about crushes. This is the age to really open the door to ongoing conversations. Keep it age appropriate, but try to be honest and warm, and try to stay open for questions. Be sure you know what your child is asking when they do ask you a question. So before you answer them, you might want to have them explain more about what it is they're asking. For older kids, Dr. Nienow recommends the video Tea and Consent. I'll include that link in the show notes as well. While most behaviors are normal, there are a few red flags you want to look for. So first, sexual behavior that is aggressive, coercive, or involves a big age difference. That is a problem. The other one is knowledge of sexual acts that goes far beyond what's typical for their age. And lastly, excessive masturbation that interferes with daily life or seems tied to anxiety, that warrants further investigation. These behaviors don't necessarily mean that abuse has occurred, but they do deserve further attention from either a pediatrician or a child psychologist. I shouldn't have been surprised by this, and it does make sense, but Dr. Nienow also says that her team is seeing more unusual behaviors that are actually normal because kids are witnessing a lot more than they used to. So normal behaviors have sort of reset. How do you navigate all of this as a parent? How do you respond? All right, remember this. You do not have to have all the answers. You just have to be the safe adult who responds calmly. First, try to stay neutral. If you see a behavior that makes you worried, you can say something like, I see you're curious. Let's talk about that. Next, always use correct anatomical terms. I mentioned that before. When your child is playing with their girl parts in the bath, you can say, that's called a vulva. Everyone has different parts. It's also okay to set limits. Like I said about rubbing themselves on the sofa, you can calmly say, that is something you do in private in your room or in the bathroom. That way you don't shame the child, but you let them know what is acceptable. Lastly, go ahead and praise their curiosity. Your child can feel connected to you and like you're their safe place if you respond to concerning things that they bring to you by saying something like, I'm glad you came to me with that question. Let's learn about this together. Remember, your tone sets the tone. If you're relaxed and warm, your child will feel safe coming to you. I know it can be very scary to hear or see your young child have an encounter with another child, but kids' curiosity about their body is normal. It's a healthy part of growing up. And when you respond with calm curiosity and boundaries, you help keep them safe, and you also show them that their body is something to respect and not to be ashamed of. When we teach kids about their bodies, we raise them with confidence, safety, and self-respect. Now, what about the times you hear or see something you're afraid indicates sexual or physical abuse? What if you have a child over at your house for a sleepover and you see marks on their body, or they tell you something worrisome? Dr. Nienow will be back next week without the wood chipper, and we will cover what you can do when you suspect child abuse, and that's on the next episode. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.